Hello, this is Dr. Lewerenz, Longevity Health Institute. As you know, we have a couple locations here in Rochester and in Madison Heights and soon to be Bloomfield, Michigan. So hopefully you can find us on the web and find us there and bringing you the best of integrative, functional, personalized medicine. So listen, today's segment is going to be this: hack your appointment. What that means is ask the doctor a few of these questions anytime you have a visit. If you don't have an adequate answer, I would seek other medical advice and other expertise, and potentially even try a functional medicine doctor like ourselves, and or in your area somebody that practices more of a personalized approach to healthcare. Prevention is best. Remember that. Prevention always is best. Don't be a disease and a statistic and be put down an overdiagnosed pathway. Be proactive and live optimally, right? Hopefully you've learned that with me. But listen, so hack your appointment. 3 things you can do and 3 things you can ask, and I'll give you the scientific evidence and the backing of this. One is, what's the best diet for you? There's a lot of diets out there. What's the best way to eat? Is it vegan? Is it paleo? Is it ketogenic? Is it gluten-free, etc.? The evidence shows this. Now, this is not personalized, giving you some generality, but the evidence shows this. And I think this what is going to give you the best answer to this. Anything that's been around less than a few years, whether it's got science on it or not, I always question. Meaning, if somebody's telling you hey, this is the new diet, it's in vogue, and there's some new studies on it, etc. Okay, doesn't mean you can't follow it and try it and see how you feel, but I would question it, because dietary influences and dietary suggestions and that the pendulum swings back and forth. First it's all plant-based, then carbs are good, then carbs are bad, then too much protein, too little protein, vegan, paleo, etc. These all have some basis and some good qualities, but I think if you don't hold the grain with appropriate diet and common sense, using physiology and where there is studies, I think you can be very, very misinformed and go down to these, if you will, these rabbit holes. You always hear us preach stuff that is kind of paleo. Truthfully, it's a lot of plant-based mixed with some healthy, organic, grass-fed stuff like this, free-range animal products, okay? But it's going to be about 80-85% plant-based, and the paleo portion of proteins is literally in that 15%. What do I base it on? Well, I base it on studies that are out of books and out of studies out of the China study, based it on books that are called the blue zones. Blue zones are where people live in the world the longest and the healthiest, not just because of diet, but because of lifestyle stuff. But I will tell you that in those areas of the world where people live the healthiest and the longest, they eat more Mediterranean, more plant-based, but they do have some limited animal products, so that you keep your iron up, you keep your B12 up, you keep your mass up, you want muscle and bone. When you actually get what we call sarcopenia, and in life you lose mass, all studies show you have the highest mortality risk. So you want to keep mass as you age. Doesn't mean you have to be hugely muscular or big, but you want to maintain good muscle and bone, obviously, with aging. People that get older and lose mass get frail, get weaker, and actually all studies show that actually they are the highest risk for all diseases. So that is something that you can use to hack your appointment and with your doctor and or me and get some real evidence on, okay? And that's hard to refute. Even when you talk to experts in the nutritional field around the world, Mediterranean, plant-based more, but some small animal products that are high quality, high grade are going to serve you the best, okay? High diets and animal products, high heart risk, high cancer risk, especially gastro cancer risk. So always remember that, okay? Number 2, the second thing of the 3 that you can hack your appointment with. People ask me, well, I hear all this stuff about amino acids and proteins and things that are in my diet that could raise my cholesterol, raise my cardiac risk. So I hear conflicting things. One of the things that I tell patients to do all the time, and we do here, we use Cleveland Clinic Heart Lab, for this, but there's a test that you can do that if your liver metabolizes animal products potentially in a negative way, you get an elevation, of something called trimethylamine oxide. So we all have trimethylamine in our body when we consume animal products and meats and things like this. It's a process through the liver. The problem is if you over-oxidize that and your trimethylamine oxide goes up, you're actually over a two-fold increase in cardiac risk. Okay, so when somebody says to me, well, I hear the good and I love animal and meat products and all that, and I hear the bad, what's the value here? Well, you can check your trimethylamine oxide, TMAO level, okay, and that can give you a lot of statistical data for you personally where your risk may fall, okay? Hopefully that helps you. The third thing is, and you know me and hormones and about hormonal balance and hormonal optimization, get your thyroid tested, and not just get your thyroid tested, but make sure your thyroid is optimal. It's the most underdiagnosed and overlooked hormone condition in the country. These are studies out there that show that, okay? It's overlooked very often, especially if you're over the age of 50. Suboptimal and low thyroid is often overlooked. And I will tell you that clinical evidence shows this, and clinical studies show this, that if you have a low body temperature, you are very correlated to a low thyroid. So if somebody checks just your your TSH, and it was adequate and you're fine, but you seem to have thyroid symptoms, weight gain, cold all the time, brittle nails, losing hair, brittle hair, loss of outer third of your eyebrows, dry skin, low energy. These are very common low thyroid condition things, okay? But I will tell you, in something we follow here, not just your lab levels and your clinical symptoms in a personalized way, but we're always looking at your body temperature. Body temperature can be a very, very, very correlated condition, or correlated meter, that you can follow on your own at home. And if you're chronically under 98 degrees in the morning, and even without food or a lot of movement, a lot of blood flow, obviously not post-exercise, stuff like that, and you're still under 98 degrees and you have often very cold body temperature, it is often very correlated to low thyroid. There's an expert endocrinologist in the field, Dr. Terry Hertog from Belgium, written huge books, multiple studies, a lot of abstracts in that, and is very, very, very precise in testing thyroid, and would tell you that there's and he has books on this, a whole slew of features that just even clinically can indicate that you have low thyroid. So don't just accept your thyroid being okay, but you're often cold and have low energy and some of these hypothyroid symptoms. So ask questions about diet. What's the best diet for you? Ask questions about, are you at risk if you eat too much animal products? Ask questions about your thyroid, that it's optimal, and what's going on, why is your body temperature always low? You should not live with a body temperature, a basal body temperature, consistently under 98 degrees. Something's going on there that's causing that. There's other things, but these are things to at least start to be insightful of and try to uncover. So hopefully this enlightens you. Share with others, share with family and friends. We are plenty busy here, but you can find other functional practitioners, healthcare providers like myself, like our providers here at Longevity Health Institute in Michigan here, that can really, really put you in the right direction. We do phone consults around the country. We do connect people with other functional medicine doctors in the country, and this is the wave and the future of medicine. I always tell my patients here that the future of medicine is in personalized medicine and looking at you very individually, okay, and that's what we're here for. So have a wonderful evening. Share this with others, okay? Live well, be well. This is Dr. Lewerenz.